I'm going to read some more from the Haunted Self book, the kind of Bible of structural dissociation. And this part, it just kind of explains its take on trauma and what it thinks counts as trauma, what factors into making something traumatizing. Some events have more potential to be traumatizing than others. These include experiences that are intense, sudden, uncontrollable, unpredictable, and extremely negative. Events that are interpersonally violent and involve physical harm or threat to life are more likely to be traumatizing than other kinds of highly stressful events, such as natural disasters. Events that are not literally life threatening, but which include attachment loss or betrayal by an important attachment person, also increase the risk of traumatization. Child abuse often includes all of these event factors. In children, interpersonal violence is usually accompanied by neglect, but neglect may also occur within adult relationships. Neglect is a form of traumatization in which there is an absence of essential physical or emotional care, soothing, or restorative experiences from significant others. In children, these experiences are developmentally requisite, and in adults, they may be needed under certain circumstances, such as the aftermath of potentially traumatizing events. Recurrent exposure to major stressors over time, such as child abuse, appears to have the most pernicious effects on survivors. Chronic traumatization increases the risk for trauma related disorders and for more severe and extensive symptoms, including illicit rug use and unaliving attempts. These include not only mental but also physical symptoms because brain development and neuroendocrine function are compromised. Chronic traumatization is a major factor in the development of more complex forms of structural dissociation. Lack of social support constitutes a major risk factor for the development of trauma related disorders. This may be especially true for children because they are so completely dependent on adults for help in integrating difficult experiences. Comfort, support, and care are essential in maintaining and improving an individual's mental efficiency, in part because they have important physiological calming effects and favorable effects on the immune system. Supportive touch is a major stress reducer and can help modulate strong emotional reactions. Many adults experience acute distress and some intrusions in the aftermath of overwhelming events, but these phenomena usually dissipate over weeks or months and generally do not develop into trauma related disorders. These peritraumatic intrusions can be regarded as manifestations of temporary and minor division of the personality prior to the complete integration of a stressful experience. But some individuals go on to develop trauma related disorders. For example, research suggests that approximately 10 to 25% of adults who are exposed to an extreme stressor may develop simple acute stress disorder. Meta analyses found several major predictors of PTSD in adults: prior cumulative traumatization, especially chronic child maltreatment, prior psychological adjustment, family history of psychopathology, perceived life threat during the traumatization, peritraumatic emotional responses, peritraumatic dissociation, lack of social support, and gender. Maltreated children often have virtually all of these risk factors. Personality is defined in part by the interaction between our environment and our genetic makeup. Genetic factors may contribute to vulnerability to stressful situations and to personality characteristics that influence the person's risk for entering into potentially hazardous situations. However, a direct genetic link to traumatization is far from clear. A high level of mental efficiency is needed for an individual's personality to remain relatively unified after exposure to extreme stressors. Structural dissociation occurs when an individual's mental efficiency and mental energy are too low to fully integrate what happened. Mental efficiency varies from person to person and increases with age but generally decreases with old age and tends to change with variables such as physical and mental energy level, physical and mental health, mood and emotion, and stress exposure. The mental efficiency and mental energy of mentally healthy individuals are balanced, i.e., a high mental level, allows them to integrate mental events relative to their own developmental level. Integration is prevented when an individual avoids traumatic memories, suppresses thoughts about the traumatic event, and has a negative interpretation of the intrusive trauma related memories, or is exhausted. These predicted PTSD in both children and adults. We suggest that individuals are likely to engage in mental actions such as avoidance, suppression, and negative cognition when their mental efficiency is low. This is particularly true of the apparently normal part of the personality, the dissociative part of the personality, which avoids traumatic memory. However, the emotional part of the personality, fixated in traumatic memories, can also avoid ANP as well as the present reality. On age, the presence of trauma related disorders has been linked to the age of the individual at the time of traumatization. The younger the person, the more likely a trauma related disorder will develop. This has been found with PTSD, complex PTSD, trauma related borderline personality disorder, dissociative disorder not otherwise specified, and DID. Chronic traumatization that begins in childhood stands apart from other types of traumatization because of a child's immature mental efficiency and psychobiological development, and his or her special needs for support and care. Symptoms of dissociation during and after a traumatizing event indicate that the individual's capacity to integrate at least some of the experience around the time of the event is insufficient. The presence of these and other peritraumatic symptoms, such as severe alterations of consciousness, are highly correlated with the eventual development of serious trauma-related disorders. Psychic trauma is related to the presence of vehement emotions, such as panic and emotional chaos, during and after overwhelming events. This hyperarousal probably manifested in elevated heart rate shortly after the overwhelming event and exaggerated startle. Both of these are predictors of PTSD. Vehement emotion involves maladaptive substitutes for adaptive action, that is, reactivity rather than reflective thinking through and careful action. Although the literature has stressed that the presence of hyperarousal as a major diagnostic criterion, it has been noted more recently that hypoarousal is also a significant problem. Not all individuals become hyperaroused during overwhelming events, or they may become hyperaroused at first and then experience a serious and involuntary drop in consciousness, which is hypoarousal. When individuals are extremely hypoaroused, they may not encode much of what is happening, they may feel the event is not real, and may experience emotional and bodily amnesia. To the extent that individuals nonetheless recall the events, all of these experiences make it difficult for them to eventually fully integrate the experience. The meaning individuals assign to an event, such as it being an act of God, a punishment, or one's own fault, is significant in the development of PTSD. Children typically believe that abuse and neglect is their own fault because perpetrators and others often blame them, and because they may not know how else to understand why caretakers would hurt them. Belief that an event is physically threatening has been linked to dissociation. The way in which people respond to an event depends to some degree on their level of preparedness for such an experience. Although it is hard to imagine how a child could be prepared for further chronic abuse, resilience studies may help us gain more insight into how children cope adaptively with adverse experiences. This knowledge may be helpful to children who have lower integrative capacities. In conclusion, whether or not an event has been traumatizing can only be inferred from the effects it has on the individual and therefore can only be determined after the event. The psychological and biological factors discussed above are known to lead to increased vulnerability to traumatization, that is, development of structural dissociation of the personality.